Good morning to my friends. Good morning to my viewers. It's the Urban Disruptor Show. No, I'm just kidding. That's not really the theme song. But I gotta tell some corny jokes and smile a few times because this is a very, very serious topic. This is a special episode. Good morning. My name is Sean Brown. I am the Urban Disruptor. I am going to share. I'm going to share this video and make sure that as many viewers are watching it as possible. You're probably watching this on a rebroadcast, so just bear with me for a few minutes. We're going to get right into some really what I think to be critically important topics and issues about what's going on in our community. I got to make sure that I can share this so people can see it. I appreciate your time. I appreciate your attention. I appreciate you. We're going to talk today about resources related to mental health, resources related to housing. Give me one moment. I got to deal with the flaws of Facebook Live as I do this. I'm going to have some guests that come on in a few moments to discuss these things with us. So if you know anybody that's facing food insecurity, which is the technical term for folks are hungry because they can't afford food, housing insecurity, which is the fancy term for people who are one way or another homeless, whether they're sleeping in the streets or more commonly couch surfing, something involved in something on the sexual coercion where a woman could be in a relationship with a man only because she needs a place to live and he's forcing her to do things she doesn't want to do. It's a tough topic, but it definitely happens. This is the video for you. So I don't think that some of the social service providers have great marketing for the services that they provide, and also think that some of the systems could be improved. So this, oh wow, you guys can probably hear that. This is for you. I really hope that ends soon. That's actually pretty annoying. Listen to that. The sounds of the neighborhood. Welcome to Camden. Here you go. Nice and fresh. So if you weren't awake at 10 o'clock, here it is. It's not my car. Oh, it ended. That's good. You never know how long you never know how long something like that's going to go. All right. I see our guest, Miss Omitri, in the waiting room. Thank you. You'll be brought on in a few minutes. Hey, Tone, how are you? You'll be brought on in a few minutes. I want to start by sharing. Oh, yeah. So if you're watching this, please share it. We want to get as many eyes on it as possible live so that people can interact. People can ask questions. People can put in their comments and questions about the services that are provided. I also made sure I invited all of our elected officials, appointed officials to watch this. I don't know if they will or will not, but I did that because I want to make sure that they hear directly from the people, see what the perceptions are out there for what's going on in our community. I got to keep sharing this. I got to share manually. It's really the once I'm live, it's the only way to do it. So as you're watching this, just think about your questions that you have, maybe about cash assistance, SNAP benefits, and other things like that. You get me nice and rough this morning. I'm gonna be in a wedding later, so I'm gonna have to get myself all dialed up. I'm trying to rock this little mini fro here, so feel free to let me know what you think of that as well. All right, I'm gonna just share this in a few more spots. This is on YouTube. We're coming to you this morning from the Urban Disruptors Facebook page, from the WCMD Media Facebook page, and also from YouTube on WCMD Media. So there are 3 different platforms that you can share this from. If you don't know how to do that, you can get the link after the show is over and you can share it so that people can see it. Hope everybody is drinking water, is trying to live a healthy life, is focusing on what they can do to lift themselves and their families in these trying times. I know that it's rough out there, and I pray for everyone's happiness and success, because it's a lot going on. All right, I'm going to share this to a few more groups, and then I'm going to get started. The first thing I'm going to do is go over a list of resources, and then that's what's going to take a few minutes, and then I'll bring on our guest, and we're going to have a fantastic conversation. This is because I know so many people that are suffering, and I'm motivated to do this because I know so many people I know a lot of people that are suffering. They're hungry. They don't have a place to stay. They're sad. They're abused. And a lot of times people don't know where to go. And some of the people that they do go to aren't as helpful as they could be. Not true for the guests that I've invited today. I'm a man of fantastic taste and commitment, and I invited only people whom I know are have a history of doing really good work, of having the best of their community in mind. And I really appreciate them taking time on a Saturday morning to do this. It was somewhat spur of the moment, just because I just keep hearing just different problems and issues that people are having. I don't know what some of the answers are myself. So I wanted to make sure that I did my part with this platform of sharing information with people. So, all right, I think I've shared this enough. So I'm going to now start this off with, oh, look, there's two guests we don't have yet. I'm going to start this off with a screen share. Okay. And hey, Ebony, welcome to the waiting room. Okay, I'm going to start this off with a screen share, and then real quick, and then we'll get into and then I'll bring the guest on in about 3 minutes. So I'm on a mailing list for the District Council Collaborative Board. I actually am going to go. This is my email. I'm actually going to go all the way to the bottom of this email and click. This one doesn't have it. All right. So this is a list of some of the resources that are available. So here you can see that there is food distribution, and you can see the dates. Some of these dates have passed, but the next one is November 5th, Kramer Hill. So this is several days free for Camden residents. You must have ID. Not all of them make you show ID, but this one does. And this one looks like it's sponsored by the city government. The Heart of Camden has distribution Thursdays of food from 11:30 to 2:30 on Broadway. You can see here fresh food, canned goods, diapers, other supplies. Mighty Writers. Hey, guys, I just started a new relationship with you, and I'm glad to. Mighty Writers, which is a great program in South Camden, also known as 6th and Ferry, has workshops, mindfulness classes, mentors, and tutoring going on. Here's another thing, food distribution, another food distribution program. The Kroc Center has a new food pantry. Cathedral Kitchen has their program on Federal Street, no paperwork needed. And then there are a few more. There's still, if you need to get testing, you can get free COVID testing. If you happen to be addicted to pills or heroin, unfortunately, there is help for you. There's a pediatric mobile services program, cancer screening. So as you can see, there is help out there. I don't know. Oh, okay, here's mental health. We're going to talk about mental health a little bit. This is by the county. It's a list of different services that are available for different people. Let me control plus this so you can see it a little bit better. Oh, I controlled plus it a little bit too much. All right. So you can see there are just different programs here. Again, heroin. This shows some of the inequities in our system, because if you're addicted to heroin, there's a decent amount of issues, and you can kind of see why here. But if you're addicted to crack or wet, I don't I really haven't seen anything for that. All right, I'm going to bring our guest on right now, and let's have a thorough conversation. So first, I'm going to bring all of you on right now, but I'll introduce you one at a time. So first, we have Miss Miss Angie Almitri with her hair looking stunning and beautiful as always. I've inappropriately flirted with Miss Almitri for a long time. I'm sorry about that. Don't tell Katrina. But thank you so much for being a guest. You work for School-Based Youth Services, and I'll give you a longer introduction in a moment. And we also have with us the great Anton Henshaw.
Hey, my brother, how are you?
Henshaw will hold you accountable. He will hold you accountable. You're going to hear it in this. Henshaw, you were my first guest ever on the show, and now you are officially my second time guest. So congratulations to me. I guess it's my honor and your privilege.
I guess I'm making history with you with the Urban Disruptor.
That's right.
But and then look at me.
And then look at this. As though we didn't have enough beautiful women. Ebony Henson. Good morning. Look at you, Ebony Henson. Hair flowing. I haven't seen you in a long time. It's your hair has grown very long since last time I saw you. I'm glad you're taking your vitamins and eating a healthy diet. All right. So I am going to end my screen share for a second. Ladies and gentlemen, if you haven't already, please. Oh, how do I share this? Okay. If you want to share this, my guest, if you want to share this, you're going to have to go to your Facebook account if you have one, and then go to here. I'll put the link in for you, and you can. Here you go. I'm gonna make this real easy, actually. All right, guys, you should see that, and then you can use that link to share, and it's also on YouTube as well. If that's easier. Ms. Casella gave a shout out to School-Based Youth Services. So let's start off with that. Ms. Armici, can you just tell us real quick what you do before I start asking the questions? What do you do every day?
Okay. I work for Camden City School District, and I oversee our School-Based Youth Services program. We're located in 5 schools under the management of the district and 1 school under the management of Center for Family Services. We are housed inside of our schools. We provide mental health supports, therapeutic supports. We provide healthy youth development through interactive activities, life skills, case management, and we have an adolescent parent program where we provide on-site childcare so that our teen parents, male or female, can continue their education. So that's it in a nutshell.
Fantastic. Ms. Omitra, I've known you for I was on the board 10 years ago, so I've known you before that. You have been committed and dedicated. You just went through almost losing all your funding, and people advocated. You work for government, so you didn't do any advocacy because you don't do that. But people advocated, and I'm glad that funding was restored in the governor's signed budget. Miss Henson, Ebony Henson, you're on mute, Miss Henson. So I think you have to unmute yourself. How you doing, Miss Henson?
I'm all right, Sean. Thank you for asking. Hope you're doing the same.
I'm all right. How so can you just tell us real quick about the amazing work that you do every day?
Sure. So I am the senior manager on the student support teams, and I oversee our school's family operations coordinators in the district. Right now, we are focused on supporting families during this pandemic. It is really difficult to partner and parent during a pandemic. When you become a co-teacher at home, you have to juggle so many responsibilities, work, and just being the support that students really need. And we know that some of our parents need additional support with doing that. It's not an easy job. It's a heavy lift for our families. So right now, although we do so many things to support families in the district, our main concern is supporting them through this pandemic as they're home, helping to teach our scholars.
Absolutely. And Mr. Henshaw, you can unmute yourself. If you could introduce yourself, the leader of Transformative Justice Initiative.
I'm not the leader. Ibrahim Suleimani is the executive director. He's the leader. I'm his partner. But
Sorry,
Um,
Ibrahim. Don't be upset. I made a mistake.
yeah, you'll see him later. You'll have to answer for that.
Yeah,
But
absolutely.
I'm his partner in it. But what I do is I guess you could say I'm that innovative guy that looks at people that are incarcerated or that are formerly incarcerated and come up with innovative ways for our city to help them and provide them with services that they need and that we need coming home after incarceration. And we do it through a public health lens and not a public safety lens, which was easier to get buy-in. So we meet people at the gate. We welcome them back into our community and let them know that we're here for them. And we use community stakeholders and people that genuinely want people to come out and do the right thing, but at the same time saying, here's opportunity. We don't take chances. We don't ask for chances. We ask for fair and open opportunities to do the right thing. And when you do chances implies risk, right? If you take a chance, it's 50-50 or whether you're going to be successful. But if you provide opportunities and you leave it up to everybody else to support that opportunity, the outcomes are totally different. And we measure by persistence and not recidivism. We do a lot of work to where like peer-on-peer mentoring. We work with the county, mental health, housing, jobs, a whole lot of stuff. We'll get into that.
All right. So my first question for all of you is to the people out here who are watching this or who have family members, who have neighbors that are hungry, couch surfing, imprisoned, pregnant, sad, depressed. What do you recommend based off of where the position that you stand in? What do you recommend for people who are suffering in our community due to COVID or just the issues of our economy, our local economy in Camden? What do you recommend? Ms. Amici, do you want to go first? Yeah, just unmute. Oh, sorry. Oh, there you go. There you go.
Right.
You're good.
I apologize. Excuse me.
That's good.
Are you able to see me? Oh, hear me? Okay. So, as we know, this is challenging times because we have not been here before. But this is a time to take time out for yourself and really get involved with your community and what they have to offer you, and not do it as an individual, but do it as a family unit. Connect with your friends, whether you're young or old. When you come together and you seek support, a lot of times we don't like to ask for support. Sometimes people think that's a sign of weakness, but it isn't. It's actually a sign of strength. So tapping into resources that are available to you through our government, through our county, through our school district, through your faith-based organizations is very important. In addition to tapping into resources, taking time out just to look and research what is important to you, and you can do that by taking and setting small attainable goals each week that's going to build on your capacity as an individual is important. Our young students who are in school and are going to transition into adulthood can start looking and researching schools that fit their needs, connecting with their guidance counselors at the schools, connecting with other college graduates, because there's so many organizations out there that are willing to help from a virtual standpoint, since we are limited to lack of in-person communication.
Thank you. Ms. Henson, Ebony?
Sure. So we know, as Andrea said, that this is something that we hear everybody say. We're in unprecedented times. These are things that we had not experienced before. And so with COVID-19 and the pandemic, it can be very stressful on families and very stressful on people in general. It produces a lot of fear and a lot of anxiety around the unknown, and a lot of fear and anxiety in families feeling like, I don't know if I can make it. Lots of people have been laid off. Lots of people, we're seeing domestic violence on a rise because families are spending more time together than they've ever spent before. And so I don't, it just seems that not everyone is prepared for something like this. Some of us have better coping skills and know how to adjust and know how to put things in place. But a lot of people don't have that, and we can't blame them. But we have to be able to support them. Social distancing can make people feel isolated and feel lonely. We went through a period where there was a shutdown, and people are sitting in their homes a lot of time alone. And so we have our seniors that we need to be concerned about, that are lonely, and we need to support our families by offering opportunities like this, where we can come online and help them understand how to cope with stressful and healthy ways to self care and healthy ways to care about themselves. What are the community availabilities out there for resources? And Sean, this is an outstanding platform to bring on, and I know you do, obviously, we're here, bring on those important partners in the community that can share. For instance, the Camden City School District also has meal distributions for our students on Tuesdays and Thursdays. And so there are things out there. But like Andrea said, you cannot be afraid to ask. You cannot be afraid to show up. What we're seeing in the district is that families, lots of families, are not showing up to those meal distributions. And we don't assume that it means that they don't need it. Sometimes there's a stigma that our families are dealing with, that they don't want to show up because they don't want to feel like they're in need. So we have to work with our families to understand that there is always times that each and every one of us, no matter what our economic status is, we need support, whether it be financial support, whether it be mental health support. Just because you may look the part and look like you have it all together. All of us on here, look like we have it all together. However, we, even on this call, need support from one another. So we can't be afraid to reach out. People need to reach out because they're having difficulty sleeping. Their eating patterns are off. There's a lot of health problems that are getting worse, and especially our mental health conditions. So I just encourage things like this. Educating people is key, and then encouraging people to put preventive things in place. Sometimes we're reactive, but now is the time to see, hey, this could go on. This could go on into 2021. We don't know when it's going to end. So as a family, sitting down at the dinner table, taking that time to talk to your kids, taking that time to talk to one another and saying, how are we managing? How are we coping? Open up the communication. Sometimes people don't like to talk, or they don't have the opportunity. Sit at the dinner table, families, open it up and ask your kids, how are you feeling? And let them tell you. And if you don't know how to respond to that and how to support them, reach out and ask for the help.
Great. I have some follow-up questions, but I wanted Tony to get his answer in.
It's kind of the irony of this is crazy, because who would think being incarcerated is a transferable skill, right? And what I mean by that is that I live this way that you guys are living out here right now because of COVID for 3 decades, and I'm okay and you're not. So it became, this is my normal, right? And it's abnormal to you guys. And then when I say, nah, like, I get it, because you haven't broken your day up in manageable chunks.
Yeah.
Right? You don't eat on a set schedule, right? The thing you just talked about. So, and then the thing is we're taught in prison never to ask anybody for help. Borrowing strength is weakness, right? But the thing is that the misapplication of that statement is, no, do I trust the person that's offering the help? Is there a relationship that's established? Is that relationship credible, right? So it's like building inroads into really what community engagement is. Just because we have food doesn't mean that people will come get it.
Right.
The next step is what relationships do we have, right, to get them to get this food and understand that this food is coming from a loving, caring, and we don't want nothing in return place. That is hard to build in relationships when you have relationships that's just sucking the life out of you, whether it be a job that ain't doing, it ain't paying you, whatever the case may be, or just a whole bunch of stuff. So I remember in the beginning, Sean had introduced me to a reporter and asked me how I was coping with COVID. And I was saying, I'm good. And he was like, how could you be good? And then I began to explain, like in the morning, I get up, I get myself together, right? I read, I drink my tea, I work out, I read again, then I eat. But this is something that I brought with me as a condition of my confinement in order to break up 24 hours of straight oppression every day.
Yeah.
And then when I began to explain this to people, like, you have to be able to organize these days, right? Even if it's going outside, and at first we couldn't go outside, even if it's going outside and taking a walk to the corner, you have to try to do some things that help you manage this thing. And then as we're working and we're doing these things and we're doing these interviews and they're talking to me, and I'm sitting there saying, like, I got two brothers that we brought home, Kevin Baker and Sean Washington. They came home to prison. They were exonerated. They came out in February. And right when they came out, COVID hit. They didn't get a chance to do nothing. They went right in the house from the penitentiary. So, but the thing is that when we were talking on the Zooms and things like that and having our conversations, they like, I'm good. But the average person did not know until we began to have these conversations about, listen, if somebody is offering you something in these times and you ain't got it, don't let your pride prevent you from asking or receiving that help. Because the thing is it's not only a blessing for the person providing you what it is, it's a blessing to receive it. Yeah. And then when we started getting into those conversations, ego and pride is a big thing in this during this COVID. You know, people wouldn't take the boxes from their academy, you know, and then when they saw us out there, well, Tone and them, they just came home. If they out there, then this got to be legit. So it's about who we have around us too, qualifying.
Tone, I sent you a note real quick, but could you just tell us about you told me a number last night, 10,000, and also about the law that the Governor Murphy just signed. Can you just tell us about that quickly?
Oh, it wasn't 10,000. I was telling you about the 11,000 that could vote in the city of Camden right now.
Right. I know it's two separate things.
Right.
But could you
on November 4th, we are going to have throughout the state of New Jersey, there'll be 2,000 people being released from prison as a result of the COVID credit bill, Senate Bill 2519. Camden County has about 188 that are returning. But as the COVID pandemic goes on, more will release. They're slated to be at least 3,000 released by January. But what we were able to do, because we were preparing for another bill, was which was Earn Your Way Out, with the Camden County Reentry Committee. We were preparing for the people that were supposed to be coming out for that bill, and then COVID hit. And when COVID hit, now there's this influx of people that are going to be back into our city, into our county. And what we did was we created services for them. Like we'll meet them, and we already have a program where we meet people at the gate when they come home. So the county has extended that. And then they're going to be vans there. If their families need to get in the van to go there to meet them. We have about 60 coming from Hope Hall on Wednesday. We have 7 or 6 from Fletcher and Garrett House. So we have 3 halfway houses in our city, and we have 1 halfway back program. I don't know how many is coming out of halfway back because that's not on. But we got the names, right? And we began to working with the county and Warden Taylor and her staff, Rosie Arroyo, Sharon Bean, and Victoria, working to say get rid of the fine fees, all the detainers and things like that, so that they have a fighting chance. And we use community stakeholders to say these people are going to need housing, these people are going to need medical, these people are going to need IDs and things like that. They're all going to be on board to welcome these people home at the transportation center on Wednesday.
Thank you. So I'm gonna. I have one more guest to bring on. She is Well, one, she's the mother of my children, so that's nice. We've known each other a really long time, and she's a nurse. So welcome, 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 Keisha. Thanks for being on.
Thank you for having me. Hi, everyone.
I have. It looks like we just lost somebody. I don't know what happened, but hopefully she'll get back on. So my next question for all of you is, Ebony, I'll start with you on this one. But what should the first? Let me say this first. What Tone just said, New Jersey, believe it or not, has some of the most progressive, forward-thinking laws in the nation. We're nowhere near where we need to be in many cases, but we are much further ahead than many states in this nation. Thanks to the leadership of the legislature, Governor Murphy. And I'll give a shout out to Bill Spearman, Bill Moen, and Nelson Cruz Perez, who are typically supportive of these initiatives. Those are the people that represent Camden in the legislative district. With that said, as I just said, there's not enough that's being done. We know that because all we need to do is look at the condition of our country and our state and certainly our city. So what should the private sector and or nonprofit sector and or government be doing that you think they are not? And I'm asking you guys this because some of these people are going to watch this show. What do you think? Would this be a lobbyist for a moment? What do you think should be happening that isn't happening?
Well, one of the things is being proactive in reaching out to, I think, the school district. One, I'm here representing the school district. And so it is a hub where all the families, you can find all the families. So I encourage those organizations to be proactive in reaching out to school districts, because a lot of times the individual classroom teachers don't know who to reach out to. So we do have people like our family operations coordinators who have those resources. But if you're a community organization out there or in the private sector, reach out to our superintendent. Let them know that you are here, you are present, and you are available. And so it's not about sitting there trying to find out who to reach out to. Reach out to the head and let them know we have those resources. We have things that can actually help our families. Don't sit behind a desk and for that phone to ring and get that phone call that families need your support. You be proactive in reaching out, letting the community know that you're here and present. Get out into the community, walk around the community that you are placed in. Don't sit behind those closed doors. And I'm not saying that everybody does, but that's what I encourage. Walking around, letting people know that we are here, setting up a table outside of your place. Don't wait for somebody to knock on the door and say, we need food or we need housing assistance. Make your presence known. And sometimes we feel like we've been in the community so long and that our presence is known. But guess what? There are tons of people coming in and out of this community that don't have any idea who you are and what you offer.
I was talking, Ebony, I was talking to some, you'll appreciate this. I was talking to somebody last week about voting. I'm like, did you vote yet? Like, oh yeah, I mean, he's like, yeah, I'm trying to vote. I'm a vote. Like, yeah, is Dana Reed running for mayor again? And I'm like, okay, one, it's Dana Reed. 2, she's not mayor anymore. It's Frank Moran. Yeah. And I hear that. Oh, look at that, my son making an appearance. And I hear that sometimes, and it's frustrating that not enough people know who their leaders are. So I think being present is really important. Keisha, thanks for being a guest on the show this morning.
Thank you for having me.
Great. I didn't have any tension in that at all. So, Keisha, what do you think the private sector, nonprofit sector, you work in the nonprofit sector, or government should be doing? Let me introduce you better. Keisha Montgomery is a nurse manager for Nurse Family Partnership. They support moms and their babies, first-time moms and their babies from pregnancy until the child is 2 years old. She's been doing this work. Let's see, well, Ethan's 9, so you've been doing this work for 8 years. Started as a nurse and was promoted to a nurse manager. We're so glad to have you on here today. So, is that a good introduction? Did I get it right?
Almost. It's been 9 years now. So.
Okay.
Yes.
Okay.
Thank you.
I don't know if that was enough to correct me on, but no, I'm just kidding. Go ahead.
So for my work, I work with first-time moms. And I think for us, the challenge is services and supplies for our mothers. And so we have the resources and we have the ability to send out emergency diapers, emergency formula, and things of that nature. Hi, Leo. But I feel like we need some more of those resources. Because often right now parents are struggling. Our families are struggling. They're out of work. They're looking for work. And if you have a newborn, it's even more challenging. So for our mothers, supplies, resources that can be easily obtained. We do have, we do share with our moms, the governmental resources that have come down a pike. But in terms of everyday, this is what I need to get by through the next day, that is what we would like to see more of. And also, housing is a big issue for our moms. We are there as sort of their own personal nurse to support them. And currently we are not able to get into the homes to do proper assessments, but we are trying our best with video and telehealth as best we can. So we're there to help answer their questions and to support them. But in terms of housing, mental health resources, it's been a challenge. It's been a huge challenge for us.
I want to show you guys. I just found this resource out yesterday. I want to show you, because one of the things that we had, like, do you guys use are you guys familiar with My Resource Pal? Do you use that?
I haven't heard of it. I've heard about it, but
okay. Hold on. I'm gonna show you guys two things. And the fact that you haven't heard of it, I'm not surprised to hear that, but it's also kind of upsetting just because, and this is why I'm doing this, because and the person that runs that is going to watch this show, and I want people to really know that, like, there are good tools and resources that are underutilized. Let me show you guys two things real quick off script here.
Drea is back in the waiting room.
I see her, but can you, Miss Ebony, can you do me a favor? Tell her she needs to connect her mic and cam before I can add her. So she has to click that on her screen. Okay, so you guys see this? This is a website, affordablehousingonline.com. Affordablehousingonline.com. Everybody can see that because I'm looking at the website. You guys can see that, right?
Yes.
So on this website, again, affordablehousingonline.com, if you put in your zip code, so I put in 08104. Oh, that's right. When you do it, you actually have to click the city. On this, you get a list of all of the places that offer, as its name suggests, affordable housing in Camden. See this? Tamarack, Ferry Manor, Baldwin's Run, Riverview Towers. Now, unfortunately, you really have to call them one by one to see what their eligibility is. You can see some of these are 62 plus. And the fact is, Tone, Ebony, you guys made this point earlier. Keisha, you made it out of pride, out of frustration, technology issues. Some people that are facing housing insecurity may not do this, but there's nobody, and I asked this yesterday in preparation for this interview, there's nobody whose job it is to help a person, no matter what their circumstance, find the best program for them. You have to shop around. And then the shopping around thing is something that people have. People have, welcome back, Ms. Omichi. People have like a mental block where, just like they don't want to stand in a line, they don't want to necessarily do the research because it is time consuming. You would have to take hours and hours of calling places, leaving messages, and and I think that when people are dealing with when they are in their deepest point of poverty, it blocks them from making the rational decisions it takes to get to the next level. I do have a wild idea, which is maybe next time there's a food line, we can have a DJ and make it into like a soul playing line or the electric slide. Keisha tells me I don't know how to dance, so maybe I shouldn't dance, but other people can. You make it fun. Make it so that when people are there, there's some there's something else going on that takes away that thought that I'm here because of the poverty that I face. And on that thought, you guys can tell me what you think of this. All the corporations in America have accountants that make sure they pay the least amount of taxes. They apply for every single program a corporation qualifies for, they use, so they don't have to spend money. So if corporations can do that, certainly we as our community, we should be, if you qualify for SNAP and you're food insecure, go apply for it. If you need to apply for Section 8 to have housing stability, go apply for it. If you're a first-time mom that's pregnant, you have nurses who work full-time, who are trained and supported by the Southern New Jersey Perinatal Cooperative, including Nurse Family Partnership, that are there for that. So does anybody have any thoughts on this?
Yes, I do. Can I just add real quick? So when our clients, our moms, are going out and getting these services that we refer them to, a lot of times the people providing these services are not, I'm trying to find the best word. It's not welcoming.
Yeah.
And so when you are in a line or you're going to, apply for something, you may be getting misinformation, things are getting lost. And I know now the process has changed due to coronavirus, but we hear this all the time from people in the community that the people offering the services, it's like sometimes they act like it's coming out of their pockets. And so even though people are, I don't want to place all the onus on the moms that we serve or people going for services. It's the people offering the services. You have to be welcoming. This isn't, when someone is going for help, that's already difficult enough. And so, people have to be understanding and welcoming of that and make people feel comfortable in asking for help.
Sean, you know most of my story. When I became to the point where my sister was moving to Delaware and I had to find a place to live, I wasn't even out a year yet. And all the service that Keisha is talking about, all the service providers in the city that, I'm a graduate student, and all the things that was happening, I couldn't get housing. And it was nothing because of what I did. It was the service providers. So I went to, I'm not even going to name their name. I went to the different organizations that everybody was referring
it's okay.
To keep. Okay. I didn't know.
This on you got nervous. It's going to be okay.
I went to VOA. I went to OEO. I went to these spaces and nothing. I went down. I had the money saved. And the thing about it is that, to Keisha's point, they don't tell you when you're inside that you're going to need verifiable income. I had over $11,000 in the bank. It don't matter. Because I left as a child, I didn't have verifiable income. Came home with savings, but it can't be verified. I didn't have a credit score because I was a kid, right? So, and then you don't have housing referral. I've been in prison for 3 decades. So who's going to refer me to these people? Who are they going to check back with? So they have these systems set up as if they're linear, like they're very linear and very specific. And then when you walk in and you don't have these things, their thing is they don't know how to deal with people like me, right? And then God forbid, people that are homeless, that are already in the community. So like to Keisha's point, when you walk in, they're not equipped to deal with certain situations that are real lived experiences right now. So what we've done and the way our network is built for people that are coming home, that are pursuing their education and things like that, we've created an affordable housing corporation where the corporation stands instead and gets the lease in the housing for the person and go in if they're not, and then we also find people, rental agencies that are returning citizens friendly. We need to start finding them for people that are homeless, people that are unwed mothers and things like that, and standing in their stead where we pay the initial deposit, 90 days, and give them a cushion to get on their feet. To expand the things that I had to learn from North Jersey to bring down here to South Jersey.
Right.
Whereas now these because really it's about these corporations or these rental agencies getting their money. They don't really care about people. It's always profit over people.
And what our society needs to understand is the more we do to lift poor people, or the technical term is social mobility, the more we do to help people climb the economic ladder, the more money that puts back into the economy. And it's a shame that people don't see it that way. My next question, I'm going to start with you, Ms. Amitri, if I can. What so the person? Oh, go ahead. I'm sorry. You wanted to respond?
Okay. I just wanted to add, like, to what Ms. Keisha and Anton said, that it one of the unique things about the city of Camden is that a lot of times we can find representation in these service areas of someone that we know and someone who's willing to advocate for us. I met Mr. Anton through having a relationship with Pam Baltimore, and she introduced him to me, and he met us at Woodrow Wilson High School to like come together and do some resources for students, and for our teen fathers and those who were impacted and possibly coming home. So word of mouth, we do have a good network of systems in the city of Camden, where if we need something or a family needs something, we have a lot of advocates such as yourself, Mr. Brown. Like you served on a board of the district. You're sitting on the planning, so you're a voice for the people when in need. Miss Henson is a product of Camden City. I'm a product of Camden City. So we have a dedication, so to speak, to want to be able to help our families in different kinds of ways. And you're right, we do have service providers approach whose customer service approach can impede people's willingness to seek and obtain uses. But there are someone that we can go to, and I think that that's important for us to link when we say get services and don't be afraid to ask. When we're doing a referral, connect them with someone in that establishment that we know to make sure that the ball does not drop, or to make sure that they're going to treat them with care as they're receiving something. So all of the food distribution centers that, for an example, let's talk about food distribution that the district is a part of. Arlethea Wright is a member of the community. She's from, so she's able to meet and receive our families. Nefessa Wiggins, who was running it at Woodrow Wilson with the other school-based teams, where most of us are members of the community or grew up in the community. And even though our community has transformed, we're still a familiar face. And so I think that that's a unique situation for the Camden City. And then we're all connected to resources in the county as well. So we're able to do that with a soft approach, so to speak. So we're not leaving our families to navigate it, independently. So I do think that that's something that we do have to pull more on, connecting resources, but not just connecting them, calling someone that we know who's going to greet them with a warm, I guess, transfer, so that they can still get the supports that they need.
Fantastic. Thank you. I just want to go into the next question. So as all of you know, many of us, I'm including myself, are dealing with trauma that may have started in our childhood. It could be from sexual abuse, emotional abuse, physical abuse, that happened in our homes, that happened in our schools, in the community, that's been unaddressed. And this trauma can drag us into a dark place at times. It can make us lose focus. It can affect our decision making, our relationships. If a person due to let's say poverty or COVID-19 restrictions or whatever the case may be, if a person feels like he or she needs a person to talk to, a therapist, a counselor, a professional, what do you recommend? Whoever wants to go first.
I'll go first. So, to your point, I think especially in the midst of COVID, there's a lot of mental health. If you already have trauma and issues that you were struggling with pre-COVID, then it's definitely exacerbated. So I'll just speak personally for myself. Therapy has been something that I've relied on, and finding a counselor had been challenging. And so there's a few websites available. When I went through therapy, I was looking for someone who looked like me. But there's a website.
You wanted a dark-skinned, chocolatey, pretty therapist?
I wanted a black woman. Yes, I wanted a black female therapist. That's funny, Sean. But yes, and so it took me a while to really find a therapist, and eventually I did end up going with a therapist who did not look like me, but there were some challenges. However, even still with the challenges, it did help me identify some things both within myself and outside of myself. That was helpful. It's helpful to talk to someone else. Although I think friends are definitely important to have around you, I don't think your friends should necessarily be your therapist. You really need to talk to someone that is, completely detached from those relationships. And so what I did also find during COVID is that the co-pays, if you have insurance, your co-pays, if you do virtual telehealth, there's no copay. So that's one advantage. But taking care of yourself, just basic taking care of yourself, making sure that you're getting enough sleep, enough fluids, exercise when you can, if you can, is all helpful.
And liquor doesn't count as fluids, just to be clear.
Debatable. But I definitely do think that it is important and it is helpful to seek out therapy.
All right, thank you. Anybody else?
I would for me, it's a little different because of the stigmas that come with it inside. And when you come out here, to say that you like something is wrong and you don't understand it. So for years, you're different. You look at things different. And then when you have those dark moments that you were speaking of, when from things that were unresolved in your childhood and throughout your life, where the trauma builds on different traumas, and it becomes so complex that you can't even get to the root of why you are doing or thinking and feeling the way you're feeling. So when you come home, or you're existing in a space that you don't fully understand, how can you ask for help? How do you know where to go for help? And then not just the help, but with people that are not going to judge, people that look like you, people that come from your experience. So it's about connecting us with people that have a lived and a shared experience. Those are the best people, and it's hard finding those kind of therapists that don't allow that stigma of mental health, or because as soon as you say mental health, people think you're crazy and you're on medication, and that may not be the case.
Miss Census, sorry, I just want to say real quick on Tone's point. A young man I mentored for many years, a judge sentenced him to a psychological and psychiatric evaluation as a part of his treatment when he was a young man that was in the criminal justice system. And I'm going to name it. They're not around anymore, but he went to Steininger at the time. So this happened in probably 2005, 2006. He went to Steininger And right here in East Camden, where I live, the young man was trapping, as they say. He was selling drugs. He talked to the therapist, who is from, I'll just say, he was from another country. He had a very heavy accent, and he quietly sits in a room, I'm told, and reads his file. And the first thing he says to him is, "I don't understand why you're a drug dealer. Can you tell me why you deal drugs?" And he said, as soon as the guy said it, I didn't really want to say anything else to him. And I've been in that young man's house, and I know the circumstances in which led him to do that. And I gotta say, I don't think that dealing drugs. I think dealing drugs is a terrible choice, but for too many people, and when they're hungry and the opportunity exists, this is the only option they have, and that judgment that people give on that is ridiculous. Especially if you're a psychiatrist is peddling psychiatric pills for every little disorder. You have no business judging a drug dealer, and it makes people uncomfortable. And this is why we need more diversity, more training in our community, to make sure that when people have someone to look like someone, when they go to see somebody, the reason Keisha wants someone who looks like her is because she wants someone who has a cultural understanding of the issues that she deals with in her life as a woman, as a black woman in leadership. Completely understandable. So I apologize if I cut anybody off before they gave their answer, but Tone, I think that's a great point. I just wanted to share that story.
Well,
Ebony, you have something to say?
well, if we look at the research in the Black community is pretty much 20% more likely to experience serious mental health issues. But
Oh,
like Anton said, there is a stigma around it in the Black community that we have to educate people and make sure we let them know that it's nothing wrong with getting the support that you need. And once you experience, I think sometimes you just have to experience. I grew up right off of Chestnut Street, Barron Street, and then out in Centerville. And I grew up with a mother and a father that were on heroin, and they were alcoholics. My grandmother was that ram in the bush for me, who took me in, my grandparents, and seeing my ask me during any given day, can I get $2.50? It was a stigma for me as a child. It was an embarrassment. It could have been.
mhm.
But for some reason, and I believe it was because of my faith and because of what my grandparents taught me, loving your parents, not knowing that you don't have to be like someone, you don't have to walk in their footsteps, but you always have to respect and love them. And that was a challenge for me, especially with my mother, because she was around more and seeing her lifestyle was very difficult. So as a young child, um, for some reason, I love talking to people and I don't mind sharing my story. To me, my story is my testimony. Yes, my parents, my father, he passed away from HIV. I experienced a lot of trauma in my life, but I wasn't afraid to ask for the help that I need, whether it was from a friend, because you have to trust the person. So you are right. I don't want to make it seem like this is easy, but talking to a friend, that is the beginning of a conversation, and hopefully that friend will say, well, perhaps you need to get some help. Therapy is key. I believe it. My family believes in it. You can't be afraid of it. I too was looking for someone who looked like me. Even my own children, when they're going through, they say, one of my daughters said, Mommy, I think I'd like to talk to somebody. And I said, like who? And she's like, but one thing, I want them to look like me, Mom. And I said, okay, so I will start the search off with that, but I don't want that to limit, like Keisha said, she ended up finding somebody and they didn't look like her. And it was helpful. And so we can't be afraid. We have to educate our community, though. It's not as easy
Just
said than done. We have to have more people speaking about their testimony. And
right.
so maybe me sharing that I had parents that I grew up with that I needed support. How do I deal with being a child of parents that were on and alcohol? We have to story I think would help other people in our community feel like, hey, maybe I can ask for help. If she asked for help, because I didn't know that that was her story, I would never imagine that she grew up with
Mhm.
parents who were addicted to drugs and alcohol. I would never imagine her father passed from HIV. I would never imagine she went through that. Because I'm willing to share my story, we have to be willing to share our stories so that other people can say, hey, I'm not by myself and I don't need to be embarrassed about that. And I can reach out for help.
Just real quick, I have a real quick question. Maybe just one person can answer. To somebody who thinks that it's okay to self-medicate by smoking weed or drinking, does anyone have anything to say to that person who smokes? I know people who, before they go to a party, before they flirt with a girl, before they go to a job interview, they feel like they got to smoke weed to relax. Does anybody have any thoughts on the wisdom of that?
Well, weed is a medication, right? And I used to, it's crazy because I used to argue with a good friend of ours about weed and smoking weed. And I asked him one day, I said, well, show me in the history books where this thing has been like his position was totally different than mine. And I'm gonna be honest, 31 years later, I was reading a book and I saw the marijuana leaf in a hieroglyph. And it was there all the time. I just never saw it. And when I went back to him and I apologized to him, and he was like, he looked at me and he was like, I don't smoke weed, I don't drink. But the point was, I went back to him and I asked him for a historical accounting of what his position was. And when I began to, now I'm out so I can go on the internet and I began to look it up, it was a whole bunch of hieroglyphs with this plant on it. And it was used historically for medicinal purposes. Now, are the people that we're talking about using it for that? Entirely not. Not everybody is using it for that.
I mean, I've only smoked marijuana in honor of my ancestors.
Yeah, right. But the point is that
look at me.
We're getting to that space where maybe some of these hard drugs that are being overprescribed to our community, all we ever needed was marijuana. Whether it was the edible form, whether it was a whole bunch of different things. And opinions are vary on this. But the point is that it's not addicting, right? But what you're talking about is somebody that became psychologically dependent on something in order to do something else. That's totally different.
Guys, we need some hope. I want our viewers to have some hope. What do you see, just real quick, what do you see that gives you hope that people can overcome the adversity that they face? You muted yourself, Ms. Amitri. Can I unmute? There you go.
Hello.
There you go.
I wanted to add to the end of the question about
yes.
mental health supports.
Sure.
And then talk about the hope piece and the self-medication piece. One is, we all know that there is a stigma around counseling supports because historically our parents and our grandparents have been resilient and kept things within their homes to address and being able to move forward with our family secrets. Unfortunately, as time has changed and as drug addiction that Ebony's speaking about, my mom was also succumbed to drug addiction. And so those things have tainted the effectiveness that you can keep things hidden in your family and try to work internally. Domestic abuse, incest, and those things that impact our families does not give us a safe haven to keep things hidden, and seeking out support is important. And so because we as a community and as a people have allowed those family secrets to even keep us emotionally trapped. So when seeking counseling, I want to give an agency out there who has a foundation of women of color men of color that provides therapeutic supports. Is Jamie Counseling and Consulting Services. They're located at 535 Route 38, the Highway Route 38, Suite 128D. That is a private practice that you can receive people of color who are licensed clinicians that have background in substance abuse and drug addiction supports, that have marital counseling, individual counseling, family counseling resources. Um, when you have medical coverage, even with Medicaid, it's important that our families, even our adolescents who are seeking mental health supports, because you can seek mental health supports to talk to someone without parental consent if you need be, just to reduce the impact of feeling suicidal, just to reduce the impact of even feeling homicidal. And so you have the authority to question your therapist. Although they are licensed, they do not
Right.
have the power or have power over them. You have to ask them, and you have to feel comfortable. You can deny a referral that a doctor gives you and say, I don't feel comfortable with this person, and see. You can call your insurance and you can ask them, listen, I am looking for X, Y, and Z, and I need someone who has background in this, or who is comfortable working with people of color, who can relate to this of an environment. And so it's just important that we feel empowered to speak up for ourselves and the things that we want when it comes to that. So hope. I also, we have intuitions because a lot of times people find counseling or guidance or mental health supports through their churches, and their pastors, or their pastors have a counseling team or ministry that you can use. But you also have to be cautious about that too, because God does not want us to suffer. So if we're in an abusive situation, he doesn't want us to have to stay in that abusive situation. So prayer is not going to get you out of that. You do have to stand up and really make wise decisions, and
That's
make
right.
sure that your man of faith or woman of faith who's leading you are of the current times, and have um, clinical background and support to match their ministry, and that they're being wise. They're not keeping you in something that is not mentally healthy for you, because I know a lot of times that can be the case, that people feel that the man of God or the woman of God um, um, support and services are bounded in God's ways and wishes, which they are, but they have to be healthy ways and things like that. And um, I reference that because I do know some people who have therapeutic ministries and faith-based organizations that are very successful
Mhm.
and helpful. But you just want to make sure that you also question those things as well. So thank you for that, allowing me to talk about the mental health piece. And in our school buildings, we are mindful of that, and we are providing supports for our students and families as needed. And those supports are confidential. We're not sharing them with the entire school body or with the community. They're confidential. So it's important. Hope. I think that hope is something that um, is like the light at the end of the tunnel. When you see, they say that um, we're a resilient people. And so just looking at how we've gotten through a lot of things can establish hope. If you feel hopeless, then that's even more of a sign that you should reach out to seek some support so that you can navigate through that and talk about it and find ways to cope. But the fact, we have to look at what brings us through something and how we gotten through a tragic and celebrate those victories as minor as they are. Just if and that's a form of hope, waking up and having another opportunity to get it right. We have to look at those little things that we take for granted and just be like, wow, I have another day, not to be a part of this hell pit, but to actually do something different and things if you're feeling, trapped or surrounded by darkness. There's always light at the end of the tunnel in that regards.
Excellent, excellent. Just before anyone else answers,
Hello?
to the guests, if you guys could just
Think
make sure
my
you share this on
camera
your own.
is paused.
Okay. Can you give me a thumbs up if I sound okay when I speak? Okay. That might be your connection on your end, Miss Almitri. But I'm gonna keep going. So if you from your own personal page, if you can share, I'm talking to the guests. If you could just share this from Facebook on your phone, we're gonna most people will watch this on the rebroadcast. So after this is finished, it will upload and then it will be shareable again in a few minutes. And I'll send you the link because this is really valuable information. Ms. Almitri, your connection, we could hear you clearly, but your connection is a little slow. But I just want to say I really appreciate what you said. I don't know if you meant to do this, but I almost felt like it was a mini sermon in itself. And I just really appreciate that. You guys are, none of you guys are going to make me cry in this, okay? So I'm holding it together. Hope. Anybody else have any glimpses of hope and how people overcome adversity?
Well, I'll just say that I'm trying to tell myself this is temporary, and I look back at all of the challenges and barriers that I've had, and so I know that I'm going to get through this unscathed, maybe not, but I'm going to get through this. We're going to get through this, and it's not to sprinkle positivity on everything because everything is not positive, but I try to tell myself that this is temporary and use this moment that we had where we're all, insular and home with our families to really reflect and appreciate what I have, and what my children are healthy. I have my family, and so I'm just trying to be appreciative for what I have now. But just knowing that I'll get through it, just like everything else.
For me, my prison father, Mr. Perkins, used to always tell me, like I used to always have this acute sense of fairness, right? And he was always asking, well, what are you going to do? And he would always tell me, he's like, Tone, it's not what happened to you. It's your response that what happens to you shows your commitment. And it's in that response where you're able to teach people through your story and how you navigate difficult situations to have hope. So as you watched with a lot of guys and you've been on a lot of conversations, they see me coming home after all of these years of incarceration, and then they go, yo, man, we finally got somebody that's going to fight for us or tell our story. And I say, nah. I said, that's not what I'm doing out here. And then they go, no, that's exactly what you're doing. I'm like, nah. I'm like, bro, I'm fighting with you. I'm not fighting for you. Right. And it's in those spaces when you have those conversations, like they don't realize that I can't do what I do if I don't have hope for them and if they don't have hope for me. And it's the same thing that I'm trying to bring to the community, that we have to share this hope. It's mutual, right? We have to have hope in each other that we can be our best selves in the most adverse situations and still come out whole and as healthy as we can possibly be. You know, we're gonna be damaged, we're gonna be a little roughed up, but the point is that our bounce back has to be greater than our fall. And that's where I bring my hope to everything that I touch.
Well, for me, I think about, well, my hope rests in my faith. When I think about when you watch a movie and you've seen it a couple times and you know the ending of the story. And so for me, knowing the ending of my story, that is where my rest and my hope lies. But in addition to that is just knowing, like Andrea said, and so many of you said, that we are a resilient people. Looking back at the things that we have overcome gives me hope. Sometimes you have to look back and be reminded of where you've come from and where you've started. We have been through so much as a people in this country that the fact that we are still here and that we are still standing and that we're still in the fight for justice and so many other things gives me that hope that if we did it before, we can do it again. And so just knowing that we do live in a community of resilient people who are going through a tremendous amount of stress at times in their lives, but seeing them getting up every day, you know, helping their kids get to school, seeing those success stories gives me hope. And knowing that we do have people that care out there, that when one person is struggling so much that they can't seem to pull the covers off their head, there's somebody there that can help pull them along. And I think really looking back and seeing where we've come from and the fact that we have done it before, for me, gives me hope. Means to me that we can do it again. When I wake up in the morning and I look at healthy children and I look at my family, that gives me hope. And even for those people who don't have that, they can find hope from within. You just have to look at your day as not everything is going wrong, but like not the cup is half empty, but what is going right. And so just identifying things in your life that are going right and focusing on the things that you can be grateful for and deprioritizing in your mind all those things that you can choose to complain about. And so, and this gives me hope. Having conversations like this gives me hope in knowing that there are people out there. And even though there are only 5 people on this line, there's a whole bunch of people Sean could have asked to come today that could spread a message of hope and share resources that they have. And so knowing that those people are out there and continuing in the fight just continues to give me hope.
I don't know about that. I only trust a few people with information like this on my platform.
Oh,
I think you should, don't undervalue yourself. You got to be invited to get on here. Only guests I have are people who have demonstrated success. So, but I appreciate what you're saying, and I do think that we are in a resilient community. But also, like Ebony, you know me, like I talk to your boss and coworkers, and I check up. I make sure people are getting the work done. Keisha hears the conversations and shakes her head. So I want to show you guys this website real quick, and then we're gonna go. Just so I'm gonna do a screen share. This is gonna take less than 2 minutes. You guys, I feel like I'm Sean Brown. I feel like Sean Carter right now because you guys could have been anywhere, but you decided to be here with me on this call, and I greatly appreciate it. So this is a website I highly recommend everyone check out. It is not perfect, but it is good. Right there, you see the Camden Coalition for Healthcare Providers logo. They manage this as myresourcepal.org. And then right here, you see, what are you looking for? And area code. I'm going to put in East Camden area code 08105, hit search. And then I'm going to X this off. You see all these categories up here: food, housing, goods. Look at that, Keisha. Baby clothes, diapers, formula, transit, bus passes, help pay for. Oh, I need help paying for. Oh, I need help with gas. I need to click on that one myself. Health, money, and then I'll click on one of these. I'll go to this one since I gave it a shout out. So baby clothes. So then in 08105, we see. I don't know who these people are. Oh, this is pretty far, but it shows you. All right, so Berlin, it shows you who is on their list that provides these services. Now, as you can see, this is not perfect because some of these are pretty far away. I'll question how many people that are suffering through crises will actually go to a website like this. So I try to show people who are service providers that there are sources of information out there that can help you help the people that you are in position to help. And again, that's myresourcepal.org. And I think I already put it in. I think I already put it in the comments. Yeah, I put it in the comments. So I just wanted to. Oh, we're in the loop. I just wanted to share that so that people could see it. Look, Tone is working really, really hard to make sure people
Thank
that come
you,
home.
Sean, for sharing that.
Yes,
Thank
you're welcome. Tone is working really hard to make sure the people that are coming home, as you heard, it's going to be hundreds of people next week, the day after the election, where we have no idea what this country is going to look like. We could be in a civil war. We could be in weird court battles. Thank God, you know, the only time I ever shot anything looked like a gun was with a paintball gun at their academy with at a bonding exercise I did with Tone and a few other people, and I didn't realize it at the time, but I want all of you to, and I'm very serious about this. Our country is going to change one way or another, and it's going to change real soon. And as we see in our government and in our nonprofit sector and our private sector, we, the strong, we, the aware that are present, we have to be united. We have to forgive each other for our past mistakes, hold hands metaphorically, and walk down the path to reform or break down broken systems, help lift the poor. Remember, Ms. Albinchi, what you said about prayer, like, I love that you acknowledge the power and importance of prayer, but also acknowledge that it's just not enough. I mean, James, the brother of Jesus, says this himself in the New Testament. You know, he says, if you see somebody that's hungry, you don't just say, hey, brother, I'm going to pray for you. Give them something to eat. And that giving them something to eat is in the form of services, it's in the form of cash, it's in the form of housing. And it's something that is upon us all as faithful, as intelligent, as people who care about our community to do. You know, I could have invited, if I wanted, I'll say that Miss Ebony Henson, the work that you're doing to support parents, who would have known that all the work you've done in the last few years would lead to this with COVID-19, where parents are now the secondary teachers in their own homes. It is creating all sorts of crises, including mental health crises. I know I had to walk away from my children sometimes. I'm so frustrated and I'm not participating. But at the same time, I have to understand that they're kids and school was not designed to be virtual from home. But we are doing our best, and I appreciate what you do. Andrew Amitri, you have been a calm and pleasant fighter for young people and the services they need for many years, and I greatly appreciate that. I actually may have known you longer than anybody on the call. And Keisha, obviously, you're doing a great job in making sure these moms. How many clients are being served in your organization right now, in Berlin and Camden counties? Oh, you're muted. I had to mute you because I didn't know what Ethan was going to say. Sorry.
Okay.
How many?
About right now, around 160.
Oh wow! No wonder you're tired by 4:30.
100.
All right, so so thank you for, that's 160 moms that are going to be better parents because of services that Keisha and her organization provides. So to the viewers, to you, I want you to know that I love you. I appreciate you. I encourage you. Thank you for encouraging me as well. I'm going to make mistakes. We all are, but we will get through it. So thank you to the viewers. Please share this. Let people know. Like it, comment. If I said something, if I got it wrong or you disagree, that's okay. We'll figure it out. So thank you very much. I'm going to, guests, please stay on for a minute. And for everybody else, take care and have a good day.